panel, we're going to have a different focus on life with ECD. And we have coming up on stage 3 folks who work here at the Mayo with you and handling many different other aspects of your life. So we have Angela Young, who is the head of patient navigation for Mayo Clinic. We have Emily Blackmer, who is a social worker for outpatient hematology, and Melissa, sorry, I haven't got a chance to ask you how to pronounce your name, Bargfrede. All right. And she is an MBA, and she works with financial counseling and navigation in that area. So shift your brains a little bit for the kinds of things that you might want to ask these folks. I think they're each going to make a couple remarks and then go into questions, right? So you all can just have a seat on the chairs as well, if that works for you. And I'll let you all. The slides. I've forgotten about the slides and thought about how you were a panel. So you want to do your presentation here, and then
maybe we should. Yeah, that might be easy.
Okay. Reorganize. Yeah. Well, that's only a pointer, and then so we really have to use this for the slides.
That's okay. Do you guys think we should have more people over here? If these are all right. I don't know. We can try it. Otherwise, we can get those too. Huh? Okay, sounds good. Hello there. Thank you for having us today. We put together just a brief presentation. We're going to go through some of the slides and then really leave a fair amount of time at the end for questions that you all might have. Just thinking that the vast majority, this will be high level information, certainly willing to take questions. Again, she already introduced us, so I'm going to skip that. First wanted to start with this slide here is the patient navigation program. When I was first asked to present at this conference, they really wanted us to highlight the patient navigation program and the structure we have here at Mayo Clinic. Want to completely understand and appreciate that a good number of people here are not patients at Mayo Clinic. So we didn't want to spend a whole lot of time on the structure that we have here, but really wanted to spend the vast majority of our time really getting to the topics in the heart of the content, in the struggles and barriers that patients face seeking care for chronic illnesses. So just want to highlight, this is the patient navigation program we have here at Mayo Clinic. It is an enterprise team, which means that we have patient navigators in Arizona, Florida, and Rochester. For those of you that are Mayo Clinic patients, you certainly can access the patient navigation program. We work very closely with social work, financial counseling, the nursing team, providers. We're very much integrated into practice. This slide here is really just an image that we want to share because it really, we want you all to understand that regardless of where you have your care, you have many people that make up your care team. And so we really want you to understand that while here at Mayo Clinic, we have a patient navigator program. Many other institutions across the country, across the world have positions that are similar to patient navigation. They just may have a different name. It might be like a patient advocate. It might be a lay patient navigator. There's lots of different terms, but a lot of times the scope of the role is similar. You have nurses, you have doctors, you always have business office and financial staff that can help, as well as helping those with insurance questions. Providers in palliative care, different specialty areas, things like that.
Yeah.
Do you want to add?
And actually, if you want to go to the next slide,
Sure.
I'll kind of introduce that as I introduce the social work role. So, my suspicion is that many of you have worked with a social worker at some point, either as part of your healthcare journey or in another setting. Social workers are kind of everywhere. But I try to explain our role as being one where we're looking at all the non-medical issues that affect people's health, well-being, ability to go through ongoing treatment, and particularly for you all is coping with chronic illness. So, I joke around with patients that I'm sort of a jack of all trades. If you need something and the doctor can't help you, you should probably ask me about it and I can point you in the right direction. So we often deal with things like mental health issues, substance use, which certainly can coincide with healthcare, this type of healthcare. And then looking at, what are the resources that you're needing externally in order to successfully go through your treatment. So for some people, that's looking at employment concerns, financial issues, housing dynamics, family support, or other external support networks, and providing, linkage to outside resources. And in a hospital setting, social workers work on an inpatient side. They sometimes work on an outpatient side like we have here at Mayo Clinic, but we're really connecting with the outside community. So it's not meant to be sort of the be all end all in terms of seeking assistance like mental health care, but it really is a way to sort of navigate those external services. One note that was from the last slide was we talked about palliative, and one of my sort of little things I like to talk about in groups like this too is really differentiating between palliative care and hospice care, because I find that for a lot of patients, when we talk about palliative care, it's like a immediate reaction of assumption that I'm saying hospice care, and right, hospice care is more end of life care, making someone comfortable when you're no longer pursuing treatment, whereas palliative care really is geared more toward chronic illness and the life-threatening illness and potentially terminal illness, but something that you could be living with for a long time and really needing sort of holistic care and holistic, people addressing, the root problem so that all the areas that are affected can be managed cohesively. So. Go ahead.
Yeah, and I'll just add, certainly the financial component of your coordination is important. And so we call it financial counseling. It may be called something similar or different, depending on the organization that you're being seen at. But, it could be the business office, it could be patient account services, it could be a patient advocate. But, we're really here to help you and provide you with cost or price transparency in terms of what is the estimate for the care that you need, bumped up against what your coverage is. And so what you might expect from an out-of-pocket perspective. We help and we coordinate with prior authorization so that we ensure that if your coverage or your insurance requires a referral or an authorization, we're helping you make sure that that is in place. And then even after care, if you unfortunately have a denial from your insurance company, we help you work through how do we address that? How do we appeal that? And then ultimately, if you have a large out-of-pocket balance, what are your options in terms of financial assistance that may be available, often is available at the institution that you were being seen at.
So the next few slides, we're going to spend just a few minutes kind of reviewing high level. A lot of these points that are on these slides really came from listening sessions from all of you. We asked for that feedback. We wanted to really know what it is what you wanted to know. What were your struggles? What can we talk about that would be meaningful to you? So we got that information, and out of that, we sort of pulled together some themes to create these next couple of slides and provide us some structure and some talking points. But again, like I said, we will take questions at the end and try our best to answer those to the best of our ability. So really the many of the questions that came through were around communication with healthcare teams. How do I coordinate my healthcare teams speaking to one another? How can I ensure that everybody's on the same page? I think that can be really difficult if I'm being completely honest. And so we want to acknowledge that that can be very, very challenging and frustrating, because the last thing you want to do is spend time and energy trying to make sure everybody's on the same page. But I think the one thing that we all agreed that you could try to do to ensure to the best of your ability is make sure you have release of information on file. so that everybody has the approval to speak with one another, whether that's healthcare facility to healthcare facility or your family member calling in on your behalf. We're all bound in the healthcare world by HIPAA, and we cannot disclose information without having those release of informations on file. So I would say that would be step number one. And so that was our biggest tip, but certainly we can take other questions and thoughts that you might have around that. The next component is health insurance. I'm going to let Melissa talk a lot more about that because that's really her area of expertise. So.
Sure. So most importantly, ensure that you have medical insurance or what is your avenue in terms of how you're going to be able to pay for the services. Just if you have medical insurance, make sure that that is in place. You're not letting that lapse. It's important to understand your insurance benefits. And so understand whether you're in or out of network at the facility that you're being seen at. And then are there any referrals or authorizations and things like that that would be important for you to have in place in order to have the highest level of reimbursement for the care that you need. You can call your insurance carrier to inquire about your benefits and whether you're in or out of network at the facility that you're being seen. And the facility can help you provide the information that you need to do that, whether it be a tax ID or a NPI number or, perhaps CPT codes for the care that you're scheduled for. Financial counselors are available at the medical center, typically by phone or in person. Again, they may be called financial counselors, they may be called something similar, but that's always something that's available to you. And then lastly, it's important to understand if you have a referral or an authorization that is required, that you confirm that this is in place. And again, the financial counselors can help you with that. I'll kick off the financial aid component of this, and then I'll pass it back to Angie and Elizabeth. There are often grants or copay assistance that are available related to the medical treatment that you're being seen for. So definitely that's something that is, I know from a grant perspective, there's LLS and there's a multitude of copay assistance based on the drugs that you may be treated with. And then lastly, and I think I mentioned it before, often there is financial assistance available. So if you find yourself with a large bill that is causing you financial hardship, you can apply for a financial assistance adjustment. So it could be a full adjustment, could be a partial adjustment based on that application. That's always something that you should inquire about.
And that's through the healthcare system.
Yeah.
Yeah, with your medical bill.
I would just add too that for most, not all, maybe I should say many medications, pharmaceutical companies have a lot of support, even just through the pharmaceutical company themselves. So there are nonprofits and foundations that you can go to for assistance. And there's even things like GoodRx or other types of prescription programs where you can get coupons for drugs. And I have been, in the years I've been in healthcare, really shocked to see how many coupons and things like that you can actually use towards various prescriptions. So I always am exploring, if, we all know that healthcare, whether you have insurance or not, is financially toxic. So, any support that you can get, especially from a pharmaceutical company, I encourage you to explore, and then explore what's local to the treatment facility that you're at. Like, for example, here in Rochester, there are several foundations and nonprofits and just local community outreach efforts that our patients who come here can access. And that is true around so many medical centers. And that talking to a social worker or a patient navigator, they're probably going to be more privy to that information than you are, and probably have more time to look into it or are getting paid to do that. So, really advocating for yourself and asking, what are the local resources available to me here? Is there something I can apply for? Even a few $100s worth of grants can be helpful.
And the only thing I would add to this is, I think for each individual patient situation, what resources and grants and fundings are available vary so greatly. So to publish one consistent list that would apply for all, we really take the individualized approach, which is why we have patient navigation. That's why we encourage you to ask to speak with a social worker. As Emily mentioned, the best thing you can do is ask to meet with a navigator or a social worker, someone that can help get you going in the right direction, give you that short list of things that are meaningful to your situation so that you are spending your time and energy applying for the grants and programs that would apply in your situation. We oftentimes work with patients alongside them to work through those grants and applications, ensuring that you have a complete application with supporting documentation. But we also need you to kind of help along that process. So it's sort of a shared responsibility, but really starting with your healthcare team and asking to meet with a social worker or patient navigator or someone in that type of role would be the first best step, I think, in my opinion. The next few slides here really kind of talk more or get more in depth on that social work role and treating kind of that whole patient and follow along with some of the themes that we heard through the feedback that we received. So I'll let Emily start with this.
Yeah, I just want to highlight a couple things. I'm not going to go into depth on any one of these things because we really would like to hear what your specific questions are and we can go from there. But certainly, living with a chronic condition affects all areas of your life. And so when you're talking about realistically making arrangements that will allow you to have a good quality of life, employment is a piece of that. And so is in, getting some form of income, even if it's not through standard wages. So talking with a social worker or a patient navigator about what are some of my options, like accessing any kind of, Americans with Disabilities Act accommodations for a workplace that you might already be in, looking at Family Medical Leave Act time, if that's something that's available through your employer, both that applies for patients as well as caregivers and family members. Or looking at things like Social Security disability insurance. What would that be for you? Would it be something you would be eligible for? Would that fit with what your needs are? So there are a lot of options, and having those conversations about, hey, this is kind of where I'm at with what's going on in my illness, but here's what my needs are from a family and financial perspective. I did want to highlight something around mental health care, because this is such a huge part of social work, is that with your health insurance, you are entitled to mental health care services. What your copay is another conversation and would depend on your coverage. But every single health insurance company is required to make available to you counseling and therapy services as part of your insurance plan, as part of the Affordable Care Act. So they can provide you a list of people who would be covered by your insurance, or there are ways to find a provider, a therapist, who would accept your insurance even without calling your insurance directly. But please know that is included in health insurance. So I often hear people say they don't feel like they could afford to do therapy. There are also a lot of free resources for people coping with chronic illness that are mental health care type services, whether it be support groups or other types of services. And then, lastly, just wanted to highlight that, it really is so important in terms of your success and longevity in coping with chronic illness to see it as a whole person, whole body experience. And that there are things that need to be addressed that are equally valid as what you're getting from your providers, that necessary life-saving treatment. But there, it is a time where allowing friends and family to maybe even step into a different role than what you're accustomed to having with them, really allowing that change and shift to be something that you embrace and talk about with your family, talk about with your friends. What is this going to look like so that we all can maintain some amount of mental wellness and emotional health while dealing with chronic illness? And I think starting those conversations can also be something that you do with a mental health provider or a social worker or a patient navigator and say, I really feel like we need to have some conversations around what do we want our quality life to look like now that this is a piece of it. So that's all I was going to say about that, I think.
Yeah.
Did you want to add anything?
I don't think, other than I would just say, part of why we pulled together the panel we did with financial counseling, social work, and patient navigation is that they're so intertwined, right?
Mm-hmm.
Financial component is so stressful, and it oftentimes is a lot of barriers to continuing care, accessing care, travel to get the care that you need. So at Mayo Clinic, we've really seen the benefit of combining and working together and across all teams within the cancer center, really, so that oftentimes Emily and I are the ones that will hear from patients, their struggles, or will notice they're no showing for appointments because there's concerns with financial. We don't deal with the financial, but we're going to call Melissa and we're really going to have her team step in and we start really troubleshooting, because the end goal for every one of us is that patients have access to the care that they need with the, least amount of barriers. So
Can you take questions?
questions,
Yeah.
yeah.
We probably have about 10 minutes for questions, and I know we have some microphones that can come around the room. What's something you all are dealing with at home? Right here.
Was here in 2014 and my diagnosis was missed. I didn't get where I needed to be. Saw two doctors here. They missed it. Okay, so I didn't get where you were, but this has been so informative. One thing I think you said, Emily, was ask questions. Yeah, thank you.
Yeah, I mean, and advocate for yourself. Social workers are advocates, but ask for a social worker and say, what is out there to help me? Or if you're not feeling heard, right? Get someone from your setting on your team to say, hey, she's not feeling very heard right now. And we need to have a larger conversation with the treatment team that maybe we bring in other voices.
Hi, thanks for coming. My continual complaint about caring for my husband here has been dealing with the makers of these rare drugs. We were getting some help paying for it. And then this year, they didn't let us have any kind of financial help because we quote unquote made too much money. We don't make a lot of money, but it just astounds me because the monthly cost is huge. I mean, our copay is huge. Have you run into this with other people? The company is Novartis. That's the company we have problems with.
All day, every day. I mean, I hate to say it, but you're not alone in that. And it's something that is very frustrating for us. And while there are many resources, there are also times that there aren't. And I think that's certainly a frustration, and you're not alone in that. And I think that's where a little bit of for me, like the macro side of social work is doing a lot of policy advocacy and really, sort of sharing what the concerns are of the people that we serve. And I think that's something I see a lot of, in our profession, is people wanting to really advocate for issues around copay. But I mean, the short answer is no, you're not alone in that. And a lot of the companies don't have that, but jump in.
And I would say definitely if there's an appeal option,
Yes.
exercise that option for sure. To appeal their decision to say that you didn't qualify.
I was going to say anything insurance related, anything related to money, never take the first no as the end.
Agreed.
You should appeal absolutely everything and take it to all level of appeals that are available. Because I feel like in many situations, it's set to give you a quick no right away. And for many people, they see the no as I'm done. But that's partly why these three teams work together, because we push and we forge forward.
Yeah. There are programs where they always say no the first time, and I appeal every single person, every single time, because even they may continue to say no, but I'm going to try.
And some of it is we need a certain number of no's before we can have access to another program.
That's
so
true
that
too.
opens up another door. So if you stop with one no and don't appeal, it doesn't open up doors for other programs.
Because you could go to another program and say, we've applied for, right, and gotten no's on all of them. So then you may become eligible for something different.
This is where self-advocacy.
Yeah.
It's challenging, and that's where enlisting the help of social work, financial counseling, patient navigation, someone in that role to walk alongside you, to support you along the way. But
And one thing I sometimes say too is, this is not to say don't pay your bills, but don't blindly pay a large copay on something without first saying, is there some amount of resource for this? Or is there some type of, conversation that needs to be had around appeal? Or, definitely don't just assume that, what is you're seeing on face value isn't something you should explore further.
I know you folks don't work for the government, but I'm wondering if you have any concept of how difficult it is to qualify for SSDI in Minnesota. You guys are all rolling your eyes.
It's I guess because it's a complicated answer in the sense that it's very individualized, depending on a person's not just disease category. So it's not simply about diagnosis. Certainly there are some diagnoses that are like, they pretty much have an open door to getting into Social Security disability. However, it's also on ability and how is the disease affecting you and what is sort of like the practical nature of your ability to work. So I also tend to find it depends who you talk to on what day and which office, which is pretty standard government. I mean,
to the gentleman's answer up there, we went through it. We just hired an attorney for our Social Security to get Holly on it, and it was simpler. Based off if you have assets or don't have assets, is going to guide you which direction you're going to go. It's SSDI or SSI, I think it is. I think it's how it's split up. But hiring an attorney in this country is probably your best bet. They're going to take a percentage of it, but at least you can get through the process of it. It's just simpler. But my question is that I know you work at Mayo, and I understand you have no control, but we know that there's great lobbyists at the insurance side of things, and that's what's killing us. I mean, we were spending $50,000 a year because we're self-employed. We don't have the luxury of getting the insurance like most other folks do. And we went down the Unaffordable Health Care Act, and the out of pocket there just for the deductible is $25,000 a year, which nobody realizes because they don't ever use that until you get to this arena. But if there is any way that as a group, even as a clinic, if we could figure out how to get lobbyists to Washington to start listening more to this side of it, I think it would be a great avenue because we went through it, and it wouldn't have been for the fact that my wife went on, Social Security, Medicare, and then I'm veteran. So I've got my medical covered, whether it's good or bad, but I've had great success with the VA myself. And I just think it's something that as a whole, we need to figure that one out because it really hurts folks. I'm not saying socialized government's good or bad. I'm just saying there needs to be a change somewhere. Thank you.
the other thing I would add to your comment about hiring a lawyer, I would say that can be very helpful with some in those situations where the diagnosis isn't quite clear cut or it's a little bit more challenging to prove the case. But before you go paying for a lawyer, make sure you look to see if there's some nonprofit legal organizations that will help represent you being a cancer patient. Because there are lawyers out there doing pro bono work through nonprofits to support patients through this process. So, but yes, again, in court, pulling in legal would be helpful.
Yeah, I was gonna say the same thing.
Other questions? Okay, perfect.
Oh.
I did leave some flyers. I think they put them out at the registration. Yes. Okay. Registration table. They are Mayo Clinic Connect flyers. I just wanted to leave those with you. Though that is a resource we have here at Mayo Clinic. When COVID hit, we had to put everything digital, all classes, all material, all education, everything. And so we have maintained parts of that now, even after the clinic has opened back up. A vast majority of our education classes, kind of living with chronic health issues, survivorship, We also have, there's a 3-part financial toxicity series that gets a lot more into all the comments that I heard come through. And so you might find those helpful. You can register for any of the webinars free. You don't have to be a Mayo Clinic patient. So just left that out there as an additional resource if anyone's interested.
That's great. And we'll pass that along in our newsletter. Or something
Sounds great.
later as well. Thank you
Thank
all
you.
for joining us today. I appreciate it.